diagram. So this is the graphical representation.
The recording.
That's why pressing
Oh,
it
okay.
here. So this is the graphical representation of the system
Okay.
for pharmacist. So there will be two. There may be two users. One is pharmacist, another pharmacy technician.
Okay.
I'm not too sure that pharmacy technician is there actually. They can use the same software that pharmacists use.
Yeah.
Okay. All right.
Yeah.
So first thing, obtain prescription by searching by MCP.
Okay.
Then dispense medicine. So when you dispense medicine, there may be 2 or 3 things under dispensing medicine. Physician, pharmacist may dispense alternative drug if she thinks, or reject prescription.
So they can dispense an alternate drug, or what was the other one?
Reject prescription.
Okay.
So pharmacist allowed to reject prescription.
Actual question is that any physician writes any prescription for the patient, if for example if drugs are not available, can pharmacist can write the alternate medicines to the patient, or he have to consult with the doctor?
In Newfoundland,
Yeah.
in Newfoundland right now, you have to consult with the doctor.
Consult with the doctor.
Yeah, yeah.
Okay, all right. And he has the ability to refill drug.
Yes.
All right.
Yeah.
Then produce bill, of course. There will be tools.
Yeah.
And there are some useful tools that we're going to implement. One will be drug interaction checker.
Okay.
Then drug allergy checker.
Yeah.
Then I'm not sure how to pronounce IV compatibility.
Okay. Yeah.
Drug compatibility.
Yeah.
Then dosing calculator. We are gonna have a tools dosing calculator.
Okay.
Then another thing, we're gonna have medical calculator.
Yeah.
So these are the basic things that we explore.
Okay.
And we need your consultant about these things, and if we can add any more tools in this system.
What else do you want the system to do for you? I mean, what would make your life easier?
Let's see. So when you first mentioned like searching by MCP.
Yeah. So when any patient goes to any pharmacy, then a pharmacist will be able to retrieve medical information, including prescription, by MCP.
Okay. So like sometimes we get like out of province people that don't have an MCP, so I guess there would have to be a way.
There is some alternative method can be,
Okay.
like last name, first name, and
Yeah.
the date of birth. We can do that.
Okay. Yeah.
So
Just interrupt for a second. I'm going to take off, guys. But don't forget Sarah, right?
Yeah.
Don't forget to get a concept of what her workflow is like, and how the new software might improve that, right? You're asking very detailed questions now. Don't forget to get like an overall concept.
Oh, okay.
What she does behind the counter as well, right? Okay?
Okay, thanks.
Okay, good luck with it, and thanks again,
Thank you.
Sarah.
No problem.
So before we indulge into details on it, so how do you receive prescriptions now?
Right now, we can either get it by a fax,
Uh-huh.
or the patient actually brings it in, or we get calls from the doctor.
Right.
Yeah.
So don't think no digital prescription?
No, not on a network. Like some of them come in printed, but there's no, like we don't go to a network and retrieve any yet. Yeah.
So we are actually trying to build that particular network, you know. So
Yeah.
for example, a doctor or physician prescribes
Yeah.
medicine, and then you receive notification or something through that system. And then, for example, so that there's no issues with the doctor's handwriting.
Yes.
And
That's
second, the
very
patient
important.
doesn't have to wait, for example.
Yeah.
If
For a fax or for a phone call if he's already there.
Right. Yeah. Yeah. And I guess what you're hoping for is that any pharmacy can have access to that prescription, so no matter what, or is
Yeah,
it
that
just?
could be universal, and once you give, you have given the medicines and everything, you can just check it or something that, okay, I've served this prescription,
So
so
it's
no
no
other
longer
pharmacist
valid.
can
Yeah.
even see it. It's done.
Okay.
You'll have it in your records, and the doctor will have it in his record. It will vanish from the network.
Okay, yeah.
Any pharmacist cannot access simultaneously.
Okay, yeah, cause that would be important, yeah.
So you must be using a pharmacy management system already installed in your pharmacy for
To keep a
billing
track of
or to keep
itinerary of all
records.
the drugs and everything. You have systems
Oh,
like
yes,
that.
yes,
So
yeah.
what we'll try is that to integrate our application into that system.
Okay,
Okay, so for example, any system you're using.
yep,
So that must be used by many pharmacies. It must be a standard or famous brand or system,
yep,
somewhere like that. So what we'll hope is that to integrate our application into that system so that you don't have to update two different systems every time you need to provide medicines.
okay, yeah.
So is that something that would seem beneficial for you?
Oh, definitely,
Yeah.
yeah, definitely.
He's trying to say that in your opinion, we are going to create a software. So, in your opinion, how our software should be, what functionality should be in our software. So, would you like to suggest something for our software?
Well, I don't know much about computers, so I
Yeah.
don't know. um, so it has to be like pretty, like easy to use, user friendly.
Yeah, user friendly interface. Yeah.
Yeah. I don't know, like something that doesn't require a lot of like extra training on,
Yeah.
you know,
I
on
mean,
a,
it should be simple to use.
yeah, like,
It should be simple to use.
yeah, especially like, I mean, there's a lot of older pharmacists too
Yeah.
that, you know,
They rely on the documentation as
yeah,
paper based.
exactly,
Yeah.
yeah.
So do you want a functionality like you can even take a printout of the prescription?
Yeah, that would, yeah, like a lot of
Add that
people
to the functionality.
like the hard
Even the
copies.
pharmacist can take a printout of the prescription that they have received
Yeah.
via the network.
Print out prescription.
Yeah. Can you think of anything else?
Is pharmacist able to see patient's previous record if necessary? If you can see patient's previous record.
EHR or EMR? Do you
Right,
have access?
right now there are some stores that are linked up to a electronic health record that can, but not all stores are. So, like I work at a Shoppers, and Shoppers can only see what we filled at our store.
Okay.
But
So it's a kind of a local database only, not.
right,
So
yeah,
do you want to have access to a global database? Would it be beneficial for you?
definitely. Because then, like, if they've only, because some people go to different pharmacies for different things, so then you don't know about any interactions that they're taking. So if you're able to see everything that they're on,
Okay.
then it's much better for interactions and safety issues. Yeah.
So I mean, what do you reckon? Is it becoming more common for pharmacists or to have access to e-prescriptions or keeping in mind the population of local population? What kind of patients usually come? Do they have that advanced knowledge about? I mean, for example, their age can be a factor.
Yes.
So, do you think that it's a good idea for even, I mean, to indulge into e-prescription?
Oh, definitely, yeah. Because I mean, even on an everyday basis, people will come in and say, "I lost my prescription."
Yeah.
So we'd have to call the doctor to get a verbal order for. Yeah, exactly. So having it on a database like that, like there's no issues with that, so you can just easily retrieve it, which is helpful for both parties. Yeah.
I have written some steps that it should be very easy.
Yeah.
It should be secured.
Yeah.
And what do you think that mostly physicians use on daily basis same medicines? So there should be a list of medicines that doctors frequently use. Is that a good idea?
Oh, yeah,
Yeah.
yeah. Medications frequently used, doses
Yeah.
for that type
There
of medication.
should be a list of, on the prescription for
Yeah,
the doctor.
yeah,
Okay.
yeah.
Okay, so do you want a summary for your store as well? I mean, like your individual store, like you give out medicines and everything. So at the end of the month, do you want the application to do something like, okay, here's your summary. These many drugs were, I mean, for a particular brand, sold these many drugs and something like that. Would that help you in your business so that we can integrate that functionality as well? Or do you have an existing system that does that for you?
We do. Yeah,
Okay.
yeah. So I think most stores do. So. Yeah.
What about insurance claims? How do you manage those insurance claims? And what do you suggest that how we will manage? We have to create what functionality we should create for the insurance claims in our software.
Um, right now, we just, most of them you bill online.
Online,
So,
okay.
so it's just, we send it to their insurance company, they send back how much they pay.
Okay.
A lot of people don't know their insurance information though, or they don't have their card.
Okay.
If that could be like a function on the prescription where it adds their insurance information,
Okay.
that would be helpful.
Okay.
Especially if they're, like, if it's not their usual pharmacy,
Yeah.
it would be helpful to just have their insurance information there.
Okay.
I don't know if that, cause it.
Yeah, make a note of it. Option you
So
can have
would you
insurance information.
like to describe the pricing process? How does it happen? I mean, I know it's a very common thing, but in your from your perspective, so what does actually happen when a patient come, and how do you how the whole process occurs?
Okay, so the patient comes in with their prescription.
Mhm.
If they're new, we have to set up a profile for them.
Uh-huh.
So, name, address, allergies, medical conditions,
Mhm.
their insurance information.
Mhm.
Then we, like, just enter all the information, like doctor, drug, quantity, dose, day supply,
Mhm.
and send it through the insurance.
Mhm.
The insurance comes back, tells us how much they're paying.
Mhm.
So then we get everything ready for them and then bring them in, check them in.
So I guess that it would be more beneficial if the digital prescriptions contains all this information already
Mhm.
for you, so that, and it also easily transferable from this application to the pharmacy management system.
Right, yes.
Okay.
Yeah.
There should be a centralized system to save the prescriptions, because a few minutes ago you said that many patients complain that we have misplaced the prescriptions like that.
Yeah.
Okay.
Yeah.
There should be the centralized system, so because for saving the e-prescriptions.
Yes, yeah,
Okay.
yeah.
Okay.
Yeah.
So, as a pharmacist, do you think would that be nice to see any diagnosis report of patients?
Yes, that's actually a good point because some of the doses are different depending on what you're treating. So to know what they're treating can sometimes like just omit a doctor's call that you don't have, you wouldn't have to make otherwise. So that'd be very good actually.
And uh, do you think the pharmacist will have the access with all these tools, and pharmacy technician, do you think will have the same privilege as pharmacist has, or do you impose any restriction in some areas that is on that?
The assistant and the
Yeah.
physician.
Pharmacy technician, their roles are actually getting, like, they're able to do more things now. So I think it's important for them to be able to have access to it. There should be restrictions though, like if there's any severe interactions that they can't proceed, they have to get the pharmacist to look at it, make sure it's okay.
Okay, so will they be able to perform a dosing calculator or a medical calculator, these kind of things, or mixing medicine?
Yeah, I think
They will be able to
that's
do
in their
that.
scope.
Okay.
Yeah, yeah.
All right.
So how long should patient's record be maintained?
Yeah.
Like 2 years, 6 years? Do you think how long you can go back to see?
For a lifetime.
Lifetime?
That's gonna be too much of storage space waste.
Yes. I know our system goes back till at least, I think, 2001, but you are
15
able,
years.
yeah, you are, if they request information that goes back further, we can call head office and they have access to it. Yeah, but I think even 15 years is
15.
quite a bit. Yeah.
I have a question that if any physician writes a prescription, the pharmacist is not satisfied with his prescription and the quantity of dosage of drugs. So, if a pharmacist is authorized to rewrite the new prescription for the
It depends on what the problem is. If it's like a dose concern or like a interaction
anything, yeah,
concern,
yeah.
we would have to consult.
Consult to the doctor.
Yeah. If it's a quantity concern, like I mean, the pharmacist can fill however many
Yeah.
they feel is necessary and put refills on it or stuff like that. Yeah, you can adjust it kind of depending on what
Dosage,
the problem
quantity.
is.
Yeah.
Yeah.
Okay.
You asked about the alternate brands, right? Already.
Alternate.
Brands like the
Brands, yeah.
brands that prescribed it's not available, but you have some alternate brand.
Yeah.
Can you do that?
Not yet. We're not able to yet
I
without.
guess the
Means,
doctor's
you are
prescription explicitly specifies if this particular, I mean, DNS, do not substitute. If it's mentioned DNS, then the pharmacist is not allowed to substitute.
Right.
Otherwise, they can. I'm
Yeah.
just.
If the doctor writes a brand name, we can give the generic brand of it, but we wouldn't be able to substitute something that's not interchangeable on, like we have a formulary of
yeah.
interchangeable drugs. If it's not interchangeable, we have to speak to the doctor.
Okay.
Oh,
But like brand versus, we can do that.
you
Okay.
don't even consult to the doctor
No.
for that.
No.
So
Sometimes, for
you
example.
just mentioned a formulary. So what kind of formulary is that? Because we are thinking of integrating a formulary in our system.
It's actually based, like every province has their own formulary. So it's just a list of medications, brand name medications, and what generic
So
brands
is it
are.
electronic or do you have a hard copy?
We have a hard copy, but it is electronic. You can get it.
Is
Like,
it free?
yeah.
Oh.
Yeah.
No. Yeah.
Okay, so
It
where
can
can
be
we find
beneficial
it?
for our software.
Yeah.
Yeah.
It's on the Newfoundland and Labrador Pharmacy Board website.
Okay.
Yeah.
But is that formulary has anything to do with the physician?
No, not really. It's really for the pharmacists. Yeah.
So
Formally there-
the pharmacy management system actually takes care of the formulary.
Yeah.
So the thing is, what we can do in our application is like if we have the formulary integrated and suppose a drug is not available, so you can just click over there, it could just show you the alternates
Yes.
right over there, so you don't have to go look through the hard
Okay.
copy and
Yeah.
all that.
Yeah.
That would be more convenient for you.
Yeah. For sure.
And the
Yeah.
use case.
Oh, is there any relation between formulary and insurance plan?
Yes. Like for instance, in Newfoundland, like there's a drug plan, like a provincial drug plan that people are covered on, and they will only cover things that are listed on the formulary. So if there's a brand, even though it's a generic like this equivalent, if it's not listed on the formulary, it's not covered.
It's not covered.
Yeah. So it has to be on the formulary.
So
But that's not all insurances.
Whatever is in the formulary and insurance covered, that is free of cost.
Yeah.
Okay.
Yeah.
And if the drug is not that formulary, he has to pay.
Yeah.
Okay.
So suppose a doctor has prescribed a drug, it's not on the formulary, so I'll have to pay for it.
Mhm.
But you have an alternate generic drug that's on the formulary and I wouldn't have to pay for it.
Right.
So can I make the decision of choosing which one to go for?
It depends on if they are interchangeable. See, that's what the formula tells you.
They're the same generic drug.
Yeah, yeah. So usually the pharmacist has to go by the formulary.
Okay, so first the preference you give to the formulary drugs and then to non-formulary.
Right.
Okay.
Yeah.
So next question, are there any particular prescription that require extra permission or should be totally prohibited from the system?
Well, I know.
Radioactive medicines or something for cancer medicines, or the heavy drugs.
The banned substances, narcotics.
Yeah, narcotics, by law, they have to be written on a certain prescription pad, so they probably wouldn't be able to. In terms of a lot of cancer medications, you have to know the patient's specific information like weight, height, body mass index, just to verify that the dose is correct. So that would be useful on those kinds of prescriptions to have that included.
So would you still prefer a written prescription for that kind of
If not if that information was on the prescription, that would be okay.
Okay.
But yeah.
So, do you think, as a pharmacist, do you need to document practice experience?
Do we?
Practice experience, do you need to document? Will there be any option that we can add? What do you think?
It's your choice. I mean, like, practice experience for a week, a month, or a year. Do you want to
Oh,
document
okay. I
it
see
or
what you're
something?
saying.
Do you think it's a good idea to add this kind of tools in your system?
Yeah. I don't know if I know what you mean though. Just
Practice experience, like what is your experience, day-to-day experience?
Like footnotes or something.
Footnote, yeah.
At the end of every day.
oh, okay. So do I think that that should be included?
I mean, what do you think about that? Is it's a good idea to add? Or it's not necessary?
Yeah, it depends on how much time it would take. If it would take a lot of time to do it, it probably wouldn't get
Wouldn't get done.
done.
All right, all right, all right.
Do you have any questions about the formulary?
So how do you conduct your operation and your job? I mean, what's the procedure? Can you explain it, just summarize it, and like the patient comes in with a prescription, like how
Yeah.
do you conduct it, and what are the steps that you have to go through?
Okay, so so you'd have to verify that the prescription is for the right person. So usually you verify by an address or date of birth, something like that. You have to, once you get the prescription filled, sure there's no interactions with their other medications. I usually see if they've had it before. Just verify that the dose is correct. You know, you have to go over the medication with the patient, especially if they haven't before, make sure they understand how to take it, when to take it, how long to take it. Is that what you mean? That kind of thing?
Okay.
So what if prescription, I mean, if the prescription has been taken care of by another pharmacy, can you like verify it? I mean, they
Do you
might be
return the
pharmacy.
prescription to the patient?
No,
or-
we have to keep the prescription, we have to keep it in the pharmacy for 2 years. And I think we have to store the prescription, like be able to have access to it for 7 years before destroying it, but it has to be in the store for 2 years.
What if it's like a refill prescription? Do you return those kinds of prescriptions?
No, we always keep the hard copy and just the refills will be on, like listed on their file.
Okay.
Yeah.
So is there any suggestion on your side, I mean, that could make your job easier? I mean, are there any things that you feel that are difficult, or you think that
Like you just said, you had to
could be made
verify
better?
multiple times and stuff, so that's a bit of a time consuming process. So if you have too many patients, it takes time, so something.
In terms of like computer systems, if it's software here, so can you think of anything that if that is implemented, that is something
It would be
is
nice.
available?
It'd be nice to be able to go back and access the prescription, because sometimes if it's entered incorrectly, like if the refills aren't right, like we'd have to go back into the filing and get the original prescription to make sure. But if you could have like access on the computer screen
Yeah.
to
You could
see.
all the prescriptions
Easy
there.
tracking.
It should
Yeah,
be
so-
Easy track.
Yeah.
Yeah.
It should be, I mean, easily trackable.
Yeah, yeah.
There should be one master file to refill drugs.
We can just
Yeah.
have a file for each
Master
pharmacy.
file.
I mean, the
Yeah.
prescriptions that they have served, they'll have access to those prescriptions only.
Okay.
Yeah.
So what role does the MCP number plays while you prescribe? Does it have any role?
It does for the Newfoundland and Labrador prescription drug program, because that's their that's basically their insurance number. Other than that, it doesn't really have a role. It's good to, if you have it, to verify that it's the right person as well, but
Somewhat role in verification.
yeah.
So how many percentage of your customers are not from Newfoundland and Labrador?
And do you,
Not a very high percentage. I'd say probably about maybe 15%.
15.
Yeah.
So you'd still need to have the paper-based system for those even after implementing the system, right?
Yeah.
And one more thing, suppose a prescription is for one of my family members or for one of my friends, and I have come to sick isn't, I mean, obviously he can't come to the pharmacy.
Okay, yeah. So the biggest issue with that is like patient confidentiality. So, um, we do it all the time for people, like you can get it ready, go over it with the patient, but, you know, there has to be some way to verify that you're picking it up for this person, so.
So how do you verify that? That's what
We try to ask them, like, if they have a file at your store, it's a lot easier, because you can ask them information about what's on the file, so you can ask, like, do you know their date of birth?
But suppose right now I come into your office with a prescription. Okay, this is my friend's prescription. He's too sick. He cannot get out of bed. So could you please give me medicine? So what
Yeah.
would you give the medicines to me or what?
Yeah, we would, yeah, but we'd have, like, you'd have to know, like, all your friends' information, so we could have to set up an accurate profile for that, for your friend, yeah.
Is there any particular medicine that you are not gonna give? You're not gonna dispense except patients.
If it was a narcotic, I might ask to speak with the friend before I gave it to you.
Oh, okay.
Um, but if it was like an antibiotic or something like that, then as long as they have information about you,
Okay.
then we could set up that.
So, how often do you have to call the doctor? What are general issues that comes up when you need to call the doctor?
It happens almost every day, and normally it's you can't read the writing or.
So several times a day.
Yeah. Oh yeah. Sometimes it's a weird dose that you just wanna check. Yeah. Sometimes the patient is expecting a different medication and doesn't know why they're getting this one, so you call to check.
So it would be good if the digital prescription comes with the doctor's contact information or
Yeah.
something like that.
Yeah.
Easy contact.
Yeah.
And so if we implement these kind of tools, drug interaction checker, drug allergy checker, and IV compatibility, how do you call that?
That's right.
IV.
Yeah.
Okay.
Yeah.
IV compatibility. So I think we need some method or some kind of formulas to implement these kind of things.
Yeah. The community pharmacy doesn't deal with a lot of IV stuff. That's mostly hospital, because that's like intravenous drugs.
Oh, intravenous.
So, that's mostly hospital.
So you don't deal with, as a pharmacist, you don't deal with these kind
But
of things.
you might have to give insulins and everything, right?
Yes.
For diabetic patient, that's IV.
That's like injection.
Okay.
Yeah, but it's not through an IV.
So as a pharmacist, do you think these are necessary tools to
I think
have in your application?
Yeah, I think the drug interaction checker for sure.
Yeah.
And the medical calculations
That's for
would
sure.
definitely be useful. Yeah.
Does your existing system has these features?
Our system doesn't, but we have a subscription to another website that does. So,
Okay.
yeah.
So
But I don't know if all pharmacies have that. I know Shoppers does.
So actually, we don't know anything about formulas, how to do that. So I might ask you to
We about the website, any
is
information?
there any information that
Oh, okay.
we can get
I mean, is
more
it
information about those
is
things?
it exclusive or?
Yeah, like we had to pay for the subscription for it. So yeah,
Oh,
yeah.
For the formulary.
For the calculation.
Drug interaction and everything.
Yeah, and drug interaction.
So
Yeah.
it's a paid service.
Yeah.
okay.
Yeah.
Oh, so you get paid for it.
Yeah.
So I think an efficient formulary would have such features. Like it must contain information on drug interactions and
Yeah.
Anything else? Do you need to check the authenticity of your prescription?
No, no. I mean, usually, like, do you mean like if it's forged or something like
Yeah,
that?
exactly.
You do if you suspect that it is.
Yeah, but
Yeah.
you said 15% you get from outside states?
From outside Newfoundland.
Yeah, exactly.
Yeah. Well, it has to be within Canada. Usually, the prescription, like, if it's on a prescription, it's hard to say. We're not allowed to take any narcotics anyway, which is most often the case that you're going to get a forged prescription
So
from.
you do not give narcotics to patients from out of the state
We do, but they have to see a doctor
over here.
in Newfoundland. Yeah. So it has to be on that specific prescription pad.
Well, in any case, if a digital prescription comes with information of the doctor, so it's kind of an authentication.
Yeah.
Because the doctor must log in
Right.
the system. So
You
I
could-
think
we
the
could also,
authentication will be taken care of.
Someday we could make it international as well. Then you would have all the verification that you
The
need.
government won't allow.
Okay, so are we left with that?
Last one, I'm not too sure how to explain this. I don't know this term. Differential diagnosis generator. This tool, do you have any
Differential
information?
diagnosis generator.
Yeah.
I don't think pharmacies would
Pharmacies.
require differential diagnosis, right?
Not. I don't think at this time that.
The
At this
final
time.
diagnosis would be enough for the pharmacy.
Yeah.
The final
Yeah.
diagnosis would
Alright.
differential diagnosis would
Yeah.
make sense.
Oh, you gave us a lot of information.
Oh,
Very
good.
useful.
Really thankful
We
to
might
you.
have a.
No problem.
You
We
gave us
might
time.
have a meeting if we have any further question.
Yeah, we'll come to you that day.
But
Will you
we
be able
hope
to
that
ask
we
you?
won't disturb you much.
Oh yeah, that's no
Yeah.
problem. Anytime. I check my email every day, so like if you need anything, just let me know.
Definitely, definitely.